I neglect my body. My mother's not really dead. My cancer says, take a look around. Look at all these people that happen to you and you don't to know that they will be so dangerous. I want you to remember that you conquered yesterday. I want you to remember that sometimes bad days are identical as you misunderstood and comprehended. I want you to know that every time you work here, breathing, life, is hanging. Thank you guys so much. I hope you guys.
You were very scary concept to people. You got to give respect. You learned about elders. So, like so many people here, you learn to get along by wearing many hats and remote switching. You talk one language to the boss, one language to your friends, one to your aunties and uncles, one to the kids you play with. And as you're trying to understand Black history, you're right, it's not monolithic. I have African brothers and sisters. I have people all over the world part of the diaspora.
So Black History Month for me is a month where we celebrate inclusion. You know, it's not part of just being Black, it's an inclusion of everyone to say we came from this struggle and it's so hard and it includes and we love everyone. Thank you.
So while I was in Memphis, my supervisor said that I discovered a gene and he said I could name it anything I wanted because the gene that he had discovered about 6 years earlier, he just named it the molecular weight of protein, which was P120. And there are many proteins with the same molecular weight. So he regretted that he did that. I had gone to many conferences at that point in time and realized there were very few people that looked like me at the conferences I went to on cancer research, and even less people at the podium talking about cancer research that looked like me. So I wanted to name the gene something to my Caribbean heritage, and so I named it Kaiso after my favorite calypso music that those of you that have lived here long enough would know is the music that you hear bombarding us in Toronto during Caravana or the Caribbean Festival, or if you go to Trinidad for Carnival. So now it's well accepted that this is the reality that we're facing. We don't know why Black women are predisposed to triple-negative breast cancer, which is one of the most aggressive breast cancer subtypes. And the other challenge is it affects young premenopausal women more so than other groups. So for white women, for example, they tend to get the estrogen receptor positive breast cancer subtype, which can be treated with tamoxifen, and they typically develop breast cancer later in life in their 50s and 60s. For Black women, we tend to develop this triple-negative breast cancer in our 30s and 40s, long before most women, not just Black women, long before many women even start thinking I should be doing a breast self exam or I should be going for a mammogram. So now the age range area has been dropped to age 40, and I encourage any woman here, especially if you have a family history of breast cancer, to please go and get screened. It's free. You can also, if you're not, if you're under age 40, you may have to pay for the mammogram. But if your family has had a history of breast cancer, you can get screened for free. So it's very aggressive, as I said. It's highly metastatic compared to other breast cancer subtypes. So this is one of the reasons we're studying it in my lab. Why is it spreading to other tissues so quickly? Many researchers in the US initially thought it was due to the socioeconomic status of Black women in the US, because their healthcare system is not like ours, you have to actually pay for it. So they thought this was why Black women in the US had a high mortality rate, but it wasn't explaining why they had such a high incidence in the first place. It was explaining why they had a poor outcome and high mortality, but not why they had it in the first place. The WHO and Global Can, who analyze and track the statistics of breast cancer incidence and mortality, has reported that breast cancer is actually an emerging health crisis in sub-Saharan Africa. Currently, the 5-year survival rate in sub-Saharan Africa is only 50%. That is 1 in 2 women diagnosed with breast cancer in sub-Saharan Africa is going to die from breast cancer. which, as you know, as a woman, if you feel a lump, the earlier you feel it, the smaller it is, your chances of survival are actually 90%. And so this is something with my community group based in North York. Okay. We go and we do these cancer awareness workshops to help educate women and men about cancer and why it's really, really important to actually try to detect it early and get treated early. So, as I said, breast cancer is the most common type of cancer among women, and regrettably the #1 cause of death of women from cancer globally. So when a woman feels a lump in her breast, when she goes to see the doctor will send her for something called a biopsy. And in that biopsy, what they're doing is they're looking at the tissues to see if any of these 3 particular biomarkers are expressed on the biopsy tissue. And these 3 biomarkers are the estrogen receptor, the progesterone receptor, and the human epidermal growth factor receptor. And these 3 proteins are